Hello, it's Dr. Rhonda Johnson. Today is Wednesday, April 17th, 2024. Today I'm talking about the common cold. Why? Because I have been fighting the common cold for the past couple of days. This has been my first cold since the pandemic hit, and it prompted me to realize that with all this social media health education I've been doing, I haven't done a single video dedicated to the common cold. Well, that is changing as of right now. And I do want to say that, folks, yes, I tested myself for COVID on more than one occasion. It's negative. So, according to the Johns Hopkins website, the common cold leads to more healthcare provider visits and absences from school and work than any other illness each year. So, folks, we need to respect the common cold. Now, what causes it? Well, you can have anywhere from more than 200 different viruses, but the family of viruses called rhinoviruses causes most colds. Now, the common cold is very easily spread to others. It's usually spread by breathing in infected droplets that are coughed or sneezed into the air, or you can get it by touching infected surfaces and self-inoculating yourself. So who's at risk for the common cold? Everybody's at risk. And people are more likely to have colds during the fall and winter. Now, the average child will have between 6 to 10 colds per year. And children suffer from more colds each year because their immune systems are more immature than adults, and the fact that they're often around other children in close physical contact at school or at daycare. Now, the average adult will have 2 to 4 colds per year. Now, again, I haven't had that since the pandemic started, so I feel a little lucky despite my misery. So what are the symptoms of the common cold? Well, you probably can answer this: stuffy, runny nose, sneezing, scratchy, tickly throat, slight cough. You may have a fever, slight fever, watery eyes. You can have some muscle aches or joint pains, sore throat, headache, just fatigue, and, just not feeling your best. Discharge from your eyes. Again, most people recover from a common cold in 7 to 10 days, although symptoms may last longer in people who smoke. Generally, you do not need medical care for a common cold, but if you develop complications, then you may need to see a doctor. Now, there's currently no medication available to cure or shorten the duration of the common cold, but there are lots of supportive remedies that you can do to help relieve your symptoms. And that can include over-the-counter cold medications, humidification, steam. Some people use Vicks Vapor Rub or, some kind of ointment or salve on the chest to, help them breathe better. Again, what's your home remedies? Mine has been chicken noodle soup and tea. That's what I've been taking and trying to stay hydrated. So again, gargling with salt, warm water, and making sure if you've got some chapped skin around the nose and lips, that you keep it soft. And again, I, just wanted to do this video out of respect for the common cold. I haven't had one for a while. Again, it's going to run its course. Colds are caused by viruses. Antibiotics don't work, folks. You don't need an antibiotic because they're only effective when given to treat bacterial infections. So that's my message today. Even with my raspy voice, I'm pressing on today. And take care, folks. Just had to give the little common cold some respect.